This video is for the assessment of humeroradial joint mobility. The scientific explanation for this technique is as follows. The humeroradial joint is the articulation between the distal lateral end of the humerus, known as the capitulum, and the proximal end of the radius, known as the fovea. According to Donald Newman's textbook on the biomechanics of the musculoskeletal system, any motion that takes place at the elbow and the forearm involves motion at the humeroradial joint. And with this being the case, any disruptions in humeroradial joint mobility can in turn limit elbow flexion and extension, as well as forearm pronation and supination. Due to the potential impact that loss of humeroradial motion can have on upper extremity function, it is important to assess humeroradial joint mobility and address any potential limitations. Knowing that the humeroradial joint is a uniaxial hinge joint, the motions available at this joint are flexion and extension, as well as some rotation of the radial head. Arthrokinematically, with flexion, the concave fovea of the radius rolls and slides anteriorly on the convex capitulum of the humerus. With extension, the concave fovea of the radius rolls and slides posteriorly on the convex capitulum. During pronation and supination, the radial head spins on the capitulum, and according to Dutton, a posterior glide of the radius is coupled with pronation and an anterior glide is coupled with supination. In order to assess the mobility of the humeroradial joint, the clinician must perform an anterior and posterior glide of the radius, as well as long axis distraction to get a sense of the motions available at this joint. To explain this technique in layman's terms, I would do it as follows. When you bend and straighten your elbow, various motions occur between the three bones that make up your elbow. In order for movement to be successful at the elbow, the bones must move in different directions to produce smooth and uninterrupted motion. In order to see how these bones are moving, I'm going to be preventing movements of some bones while grabbing and pulling others to see if these motions. The step-by-step instructions for this technique are as follows. This test should be performed on both sides of the body, and if a patient presents with the symptomatic side, the asymptomatic side should be tested first. The first step is to have the patient lay in supine with the arm being assessed on the table with the elbow fully extended. The next step is the therapist then grasps the proximal radial head as close to the joint line as possible, while the other hand is at the distal end of the humerus as close to the joint line as possible. Then a gentle distraction force is applied along the shaft of the radius, and an anterior glide is performed to assess the motion associated with flexion and supination. Then a posterior glide or a posterior force is applied to assess the glide associated with extension and pronation. The last technique to provide gentle distraction of the humeroradial joint is to grasp the radius and the lateral epicondyle, one hand on the lateral epicondyle of the humerus, one hand on the radius, and gently distract longitudinally down the line of the radius.